All right, let's head back to Hani Baragwanath Hospital. Gareth standing by to give us the latest coming in from the hospital, but also those important conversations with healthcare workers also imminent. Gareth, what do you have for us?
Tumelo and everyone watching the South African Morning again, welcome back to the Hani Baragwanath Hospital. This is a facility known as an ABT, as alternative building technology. And what it essentially resulted is in a very short space of time, less than a year, this incredible facility where I'm standing in now went from literally dust all the way up to what I think is close to 12 wards of about 23 to 25 beds each, if my understanding of that is correct. But what I can tell you is that a very, very impressive structure that we are in. But more importantly, Tumelo, is what you're seeing behind us is actually the good news as we come out of the third wave, as we now head into level 1 of the lockdown. If you saw the latest family meeting last night, it is empty hospital beds. Now, ordinarily, when we talk about any facilities being empty, we would start asking questions about the profitability and all those good fun questions. But we want, Professor Shabir, Madhi, we want an empty hospital, don't we? Good morning.
Good morning, and absolutely. This is the best picture that you can actually see at this point in time, and hopefully it remains as such. And the only way for us to make it as such is to ensure that people take up vaccines. The only sustainable manner out of this pandemic is for people to be vaccinated. When people get vaccinated, they're extremely unlikely to end up and fill one of these beds.
And do you think that the vaccine rollout and just how quickly it's been taken up, I know it's never quick enough, but it's not been bad, has resulted in us standing here, really just you and I and some of our technical team? There's no one else here.
Yeah, well, unfortunately, that's not the reason. The main reason why this particular resurgence has actually subsided is because a large percentage of South Africans have probably been infected during the course of the past 2 to 3 months. And that itself creates some sort of immunity that actually drives the virus down. But that's not sustainable, in that if there is another variant that arises, or if there's an increase in gatherings, as we're likely to experience now that we're going to lower levels of restriction, we can expect more infections to start taking place. And if people aren't protected against severe disease, unfortunately, these beds are going to fill up very soon.
And this was one of the questions I did want to ask you, Prof, when I knew I was going to speak to you this morning. I don't want to get into the politics of it. Of course, you're one of South Africa's leading medical experts. From a medical perspective, Prof, is going to level 1 lockdown a good idea? My gut sense is no.
No, absolutely. It's actually the correct idea. In fact, we shouldn't have any restrictions in South Africa other than restrictions with people gathering indoors, and especially if they're unvaccinated. Having mass gatherings outdoors is actually relatively safe. The majority of infections that takes place indoors. 80% of all infections are directly or indirectly related to indoor gatherings, and more so if people are unvaccinated. So what we need to do as a country is move beyond level 1 lockdowns. In fact, we shouldn't have any meaningful restrictions other than making sure that we have vaccination as a mandatory task. And if people choose not to be vaccinated, then there needs to be limitations imposed on those individuals in terms of how they're able to engage with others in society.
When it came to dealing with critically ill patients in a facility like this, Prof, at its worst, how full was this? I mean, it's difficult for me to now stand here and look around and imagine this full, but I didn't live through the nightmare that you health experts did.
Right, so this particular facility has got 500 beds, and I think at its peak they were admitting at about 200 beds. 200 of the beds were occupied, but that's because there's a number of other beds that are available as well. So this facility didn't actually reach its capacity in terms of bed occupancy, and there's a number of reasons for that. But one of the reasons for that is that South Africa had already gone through 2 waves of the pandemic before this facility was opened up. And again, during the course of these 2 waves, a significant number of people were already infected, and that past infection does induce reasonable amount of immunity against severe disease subsequently if they are re-exposed. So the pandemic in South Africa has been sort of different from what is experienced in high-income countries. But together with past infection, coupled with an increase in vaccination, it's unlikely that these sort of facilities will be overwhelmed should there be another resurgence.
So when we talk about resurgence, and if there is another one, off the back of what you've just spoken about now with possible infections could prevent very high spikes in numbers. I imagine then, Prof, you're going to tell me you aren't that worried about this coming 4th wave.
Right. So past infections will protect you against severe disease, not necessarily against mild infection, and especially if there's a new variant that actually evolves. So if we're talking of hospitalizations and death, I think we're in a reasonably steady space right now. Should there be another resurgence? But in terms of absolute number of cases, that can really go up. And similar to what the United Kingdom is experiencing, they're experiencing a resurgence, large number of cases. In fact, they've got 10 times more cases that are occurring in the United Kingdom right now than is occurring in South Africa. But the hospitals are pretty empty because that's not translating into hospitalization. In the case of the United Kingdom, it's because 90% of the adult population have been vaccinated. In South Africa, it's going to be a combination of increasing vaccination of the adult population, especially people above the age of 50, coupled with the past infection that's taken place already.
And when we now start looking at the declining number of vaccines that are being handed out and being administered at the moment, Doctor, I was at Discovery Place up in Sandton yesterday to go take a look at that facility as well. Also a massive vaccination facility, completely empty, and I see your reaction to that. It's not good news.
Disappointing, and in fact there's another facility just outside of this particular facility at Baragwanath Hospital, which is pretty empty, and it's been empty for weeks now. Just a trickle of people moving through, and I don't think people really. I think there's a fair amount of complacency has set in already. There's a lot of apathy. Fatigue, and then there's some level of vaccine hesitancy as well. And I don't think people really appreciate it. For us to get back to a relatively normal lifestyle, the only sustainable way to do that is to get vaccinated, to prevent people from being hospitalized, to prevent the overwhelming of our healthcare facilities, to minimize the number of people that die of COVID-19. And vaccination is the only way to do that. And the big concern right now is not about the 18 to 35-year-olds that are sort of reluctant to be vaccinated. The biggest concern is people above the age of 50. It's only about 50% of people above the age of 50 that have been vaccinated. And we need that figure to go to 80 to 90% to be able to weather the next resurgence.
Because in the last question I have for you, Prof, and I know it's a difficult question, my understanding, having spoken to an expert a few weeks ago, it almost costs the state more money to look after one 50-plus patient than it does a younger patient because of the way they get affected and the kind of conditions that they get with COVID.
Absolutely. When a patient for 50 years is admitted to this ward, as an example, or to an intensive care in South Africa in the public sector, the cost of that is close on to 20,000 rand per day. And these patients end up in hospital for a month, for 6 weeks. So you can do your maths behind it. The younger patients do end up in hospital, but fortunately they got relatively milder disease, so they might be in hospital for about 3 to 4 days in a lower care facility, which is less expensive. But management of COVID-19 patients in an ICU facility, in a high care facility such as this, is extremely expensive, even more so in the private sector, probably about 3 to 4 times more in the private sector.
How worried are medical experts and medical facilities about the elections? Again, not talking politics, from a medical side, there are concerns it's going to be a constitutionally protected and an outwardly promoted super spreader event.
Yeah, I'm not too sure about that. I think it largely depends on the run-up to the elections, not the election day itself. The election day itself is going to be a controlled activity. It's really the run-up to the elections. And the biggest concern there is when political parties have indoor gatherings, not necessarily outdoor gatherings. The outdoor gatherings are relatively safe, more so if people are vaccinated. But having indoor gatherings when people are unvaccinated, those are sort of activities which unfortunately is going to lend itself to a much quicker resurgence of the virus.
Such a pleasure being able to speak to you in person. Normally you and I do this over Zoom. It's great to stand with you in a facility like this with no patients behind us. Prof, thank you very much to you and your entire team here at Chris Hani Baragwanath Hospital. Professor Shabir Madhi, of course, needing no introduction to me. You and I get to speak to an incredible expert like him on a regular basis, and we'll be speaking to many more of those people involved here in the fight against COVID-19 at Chris Hani Baragwanath Hospital a little bit later.
Well, what an insightful conversation you just had there with Professor Shabir Madhi, Gareth, and we'll be sure to come back to you, of course, a bit later.